Bismillahirrahmanirrahim. I start with the name of Allah. This CME, the Allah, the God Almighty, is very most beneficial and very kind to us. The topic of CME by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq Masood, Ops Gynae Family Emergency Specialist, Gulf KSA, working now as district gynecologist. The topic very important for the women is dysfunctional uterine bleeding. It is basically the abnormal uterine bleeding, exclusion of all other causes of bleeding, pregnancy, genital tract pathology, and other systemic diseases, hematological diseases, and thrombocytopenias, and other von Willebrand, etc., etc., DIC. This is a very menorrhagia is a very common DUB is a very common dysfunctional uterine bleeding in most common in the extremes of life, in the present in the reproductive years, perimenopausal and post-menarche. It is more. So we have to. It is 52. Menorrhagia is the 50 to 60% cause for the referral of these 50 to 60% flooding, and 20 to 30% is the most important cause of referral, and sometimes for the higher GP consultation to a gynecological referral center. What are the important pathology behind this dysfunctional uterine bleeding? This is the abnormal PG ratios, mediators, and vasodilatation and platelet non-aggregation, in excessive fibrinolysis, and aberrant defective functions and junctional zones, and aberrant defect of matrix metalloproteinases, and these DUB is regular or irregular DUB, and we will discuss in detail, as DUB is the exclusion of all pathologies and pregnancies and systemic diseases. What are the symptoms? As already told, that it is basically the menorrhagia, excessive and irregular flooding, whether regular or irregular, but very excessive. And the point that it is excessive, more than 80 ml, is not the concern now. If the periods they are heavy, so it is basically the heavy flooding and clots and this abnormal uterine bleeding, which makes the quality of life of a woman very difficult. The second symptom is the dysmenorrhea, and we have to have the history of smears and the contraceptives, which are very important, hormonal contraception. For the we have to see whether this is due to any, as we have said. So the examination will be normal, as we have said that it is an abnormal uterine bleeding, exclusion of all the organic and causes, pathologies, and the pregnancy. It can be, but we have to see sometimes focal pathologies like polyps and the fibroids. adenomyosis, hyperplasia, polyps, and cancer, and sometime hypothyroidism and pregnancies to be ruled it out. So important thing are the investigations are the iron levels, complete blood count, urine examination, sexually transmitted disease screen, and chlamydia also, and uh, bleeding time, clotting time, coagulation disorders, thyroid function tests, and serum iron, TIBC, and serum ferritin levels. All has to be considered because anemia is a very common due to the excessive, irregular, erratic bleeding. As regards the management of the DUB, regular DUB, we can do the symptomatic measures, and we can use the drugs like antifibrinolytics, tranexamic acid, and non-NSAIDs, mefenic acid, Ponston, and then COCP, contraceptive, oral contraceptive pills, and they not only control the erratic bleeding, irregular bleeding, but also they regulate the cycle, whether regular or whether if irregular, and also they cure the dysmenorrhea. Now other thing for the, and then we can use Mirena. Mirena intrauterine system is a very effective one and can reduce the bleeding up to 90%, and it's a level norgestrel progesterone which is released slowly up till the 5 years, and its insertion is very easy, and it has resulted in the number of hysterectomies. Mirena, IUI, COCP, progesterone and the progestins are not effective in controlling such heavy bleeding. But however, for a short-term bleeding, they are very helpful. Now for the irregular DUB, the same things, tranexamic acid, mefenic acid, and for regulation of the cycle, you have to use COCP, oral contraceptive pills, and cyclical progesterone from the days 5 to 26, 5 mg TDS, or medroxyprogesterone 5 to 10 mg TDS. Mirena can also be used, and it has also resulted in a significant loss, as I've told you, 90% in most cases, and it has, as told, reduced the number of hysterectomies. Then if it is still persistent, and we need to continue the medical treatment, and it is heavy, persistent, and irregular, affecting the quality of life, so we have to give them the GnRH analogs, but they basically cause the medical menopause, and but they cannot be used for more than 6 to 12 months, as they cause the bone loss. So add-back therapy is also needed. Then we can have other choices as well if the bleeding continues, but they are not used now. As told, the medroxyprogesterone 10 mg TDS in heavy doses can be used, but there are side effects. There are other drugs like danazol, anti-estrogen, and ethamsilate. Now, as regarding this is the medical management we have considered. Now we come to another which is known as endometrial ablation, in which the endometrium is stripped off from the uterus up till the basilis layer and results in significant uh, reduction in the blood loss up till you can see 90%. These are MEA, microwave ablation, uh, Novashore ablation, electrical ablation, and we can use also use by hysteroscopic in which roller blade ablation is used. So all these are, as told, very effective and reduced, but they have their side effects: infection, perforation of the uterus, and other hemorrhage, and all these. And but they must be, and they should be offered to all those before undergoing hysterectomies. Then ultimately, if all these conservative medical and surgical measures they failed, then what is the option then? Then the option is the best one, that is the hysterectomy. Total abdominal hysterectomy is the most important one, but it is especially for those women who have completed their families and their age is high, and all medical measures they have failed. And we have, because after the age of 45 it is very important to rule out the endometrial pathology, as the risk of malignancy, atypia, endometrial hyperplasia, and endometrial cancer is very high. So postmenopausal bleeding is also one of the most important one, as tests to rule out the endometrial cancer. It has got side effects and long-term morbidity and hemorrhage, infection, risk of anesthesia, complications of the anesthesia, injuries to the ureter, genital tract, bladder, and to the intestine, remote and delayed complication, but it gives a high index of satisfaction, and the women feel and can continue her sexual activities, and she really enjoys, as she said, she is free of flooding. Second is the vaginal hysterectomy. It is also very safe, and it has got less short stay in the hospital, cost also, financial implications, and then but it takes time, and there is injury to the genital tract is high. Then is the laparoscopic assisted vaginal hysterectomy, takes more time and takes more time, and also chances of genital tract injuries are more. Then there is subtotal hysterectomy, in which the part of cervix, subtotal hysterectomy, in which is part of cervix is left behind, and that is also very cost effective, less complications and less hospital stay, less financial implication. But when the cycle bleeds, when the menstrual cycle comes, it bleeds and then there are regular smears have to be taken annually. The DUB at a gallons, in which we have to first try the medical conservative treatment, but in these cases the wishes of the woman and the reproductive and contraceptive needs of the woman should be addressed, as basically DUB is an umbrella term, and in which her quality of life is affected. And before 45 you can treat them without investigations, but after 45 the chances of endometrial pathology are very high, so it has to be very cautious after 45. And TVUS, transvaginal ultrasound, and abdominal ultrasound are also important to identify the focal pathologies like polyps and the fibroids. So wishes of the patient, and most important thing is, as the patient is flooding, having irregular erratic bleeding, then anemia has to be considered, and anemia has to be treated. Now look at a glance at the DUB. DUB, as we have told, it's umbrella term, and it is basically abnormal uterine bleeding and extremes of reproductive life, that is post menarche and perimenopause, and it is basically the menorrhagia accompanied by dysmenorrhea. 50 to 60% are having high flooding, erratic bleeding, irregular bleeding, or regular bleeding in the form of clots. So we have to have investigation for these, and we have to rule out other pathologies like, as told, adenomyosis, fibroids, endometrial hyperplasia, and hypothyroidism. Investigation, as I have mentioned, basically the basic investigation, hematological disorders to rule out systemic diseases, TVU, SS, and abdominal ultrasound. Also, if this is persistently high bleeding, then we need to have endometrial biopsy, stereoscopic needed biopsy, and if this flooding continues, then we have to continue prolonged medical treatment. And as before 45, there seems to be no cause of this abnormal uterine bleeding, so reassurance would be the cause. And as I told you, we have medical treatment like in the form of COCPs, transaminic acid, mefenic acid, oral progestogens, both for regular or irregular DUP, Mirena intrauterine system, very effective, and endometrial ablations, both microwave and electrical, and NovoSure, as well as stereoscopic roller blade ablations. And then if all medical treatment fail and the patient family is complete, and after 45 years of age, then the endometrial pathology is likely, so we can have surgical options. And what are the surgical options? These are: number one, the total abdominal hysterectomy, then comes the vaginal hysterectomy, and then come the laparoscopic assistant vaginal hysterectomy, and then subtotal hysterectomy. Pros and cons has already been discussed. We will come for another review of CME. A takeaway message is: pray, praise, trust, talk, love, worship Allah the God Almighty, and follow up of us lifestyle of Hazrat Prophet Hazrat Muhammad Sallallahu Alaihi Wasallam, our health and survivor. And we must not forget our glorious past. वो मुअज़्ज़ज़ थे दुनिया में मुसलमान होकर, और तुम ख्वार हुए तारिक कुरान होकर. We are all thankful and for the always the blessings of Allah. So we should have always be thanking to Allah. Allahumma inna zikrak, shukrak wa husn ibadatak. And we should always Hasbinullahi wa ni'mal wakil wa ni'mal mawla wa ni'mal nasir. Our glorious past दहर में इसमें मोहम्मद सल्लल्लाहु अलैहि वसल्लम से उजाला कर दे. और and also we should always be asking, praying and apologies from Allah. हम तो माइल बकरम है, कोई साइल ही नहीं, राह किसे दिखलाएं, रहबर मंजिल ही नहीं. वमा अलैना इल्लल बला. We'll come for another view. Thank you. Goodbye. Jazakallah.